Hi everyone, I am Dr. Nikhil Shah. I am a pediatric endocrinologist practicing in Mumbai. On the occasion of World Obesity Day, that is on the 4th of March, I have been given the responsibility of shedding some light on the clinical evaluation of obesity in Indian children. A lot of what I'll be talking over the next 3 minutes have been recently covered in the IAP guidelines on pediatric obesity. I was lucky enough to be one of the writing committee members as well as one of the lead authors on these recently published guidelines. The first question is, how do we define overweight and obesity in Indian children? I think the most important step in that is an accurate anthropometry assessment, that is an accurate taking of height and weight. Next important step is to plot it on the appropriate growth charts. In children aged 5 to 18 years, BMI is used to define overweight and obesity. BMI in Indian children is plotted on the IAP 2015 chart. In these charts, if the BMI is more than the 23 adult equivalent, it is defined as overweight, and if it is more than the 27th adult equivalent, it is defined as obesity. So as you can see, these are the charts. Anything more above the orange line, which is the 23 adult equivalent, is defined as overweight, and anything above the red line, that is the 27th adult equivalent, is defined as obesity. In children under 5 years of age, how do we define overweight and obesity? So to define that, we use the parameter that is weight for length or weight for height. Weight for length or weight for height should be plotted on the WHO 2006 charts, as Indian specific charts are not available. In any child in whom the weight for length is greater than or equal to 2 standard deviations or greater than or equal to the 97th percentile, it is defined as overweight. In any child, if the weight for length is greater than or equal to 3 standard deviations or greater than or equal to 99.9 percentile, it is defined as obesity. Now that we have defined obesity, the next most important step is to see that whether the child is tall and obese or short and obese. Why is this important? Tall and obese is usually because of primary obesity or exogenous obesity or lifestyle related obesity. Whereas short and obese is usually because of some secondary cause or an endogenous cause, that is some underlying endocrine cause or a syndromic cause. It is very important to differentiate between primary obesity versus secondary obesity, as the evaluation will differ as well as the management will differ. Another important thing to note is that 90% of the cases, that is majority of the cases of childhood obesity, are because of primary or lifestyle related obesity. Now that we've defined obesity, seen what is the cause of obesity, I think the next most important step for us is to plot waist circumferences in any obese child. So an accurate waist circumference measurement should be done and should be plotted on Indian specific charts. In Indian children, waist circumference greater than the 70th percentile is an indicator of central adiposity and tells us about the future risk of developing metabolic syndrome and hypertension. Now, all these charts that I mentioned in the last couple of minutes, including the BMI charts, the weight for length charts, the waist circumference charts, as well as the recently published extended IAP BMI charts, are available on the IAP website. I would request all the pediatricians to download these charts and use routinely in your clinical practice. If people want to read more on the obesity guidelines, these are again available on the Indian Pediatrics website, that is in the December volume of 2023. I would like to conclude my talk by saying that in 2017, the estimated prevalence of childhood obesity and overweight in India was 1.5 crore. This makes India the second highest country in the world with childhood obesity and overweight. So it is of utmost importance, of paramount importance, that we as pediatricians, as healthcare providers, recognize and identify obesity as a chronic disease. Hence, I think we should take steps in preventing it rather than to treat it. Thank you so much.